This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning, one of our favorite guests, Dr. Shakuri-Rad, urologist and robotic surgeon, joining us on Mon Health Talk. Good morning, sir.
Good morning. How are you?
I'm doing well. Good to have you back on. We're going to be talking about men's health, as June is Men's Health Month. But, Doctor, you've been on the show a number of times. Like I said, one of our favorite guests to chat with. So just remind people a little bit about your background, where you're from, and how you ended up working with Mon Health.
Yeah, so I graduated from Parkersburg High School, where I met my wife. We both went to WVU, and I did my medical school training in Lewisburg, West Virginia, and did my urological surgical training as well as robotics training in Michigan, and then came back to Morgantown, back home, to take care of our population here.
How did you get into urology?
Well, I used to build robots as a kid and participate in robotics competitions. And as a matter of fact, some folks may have seen recently a news article about the Mars WVU robotics team winning the international robotics competition. So very early versions of that was happening at Morgantown High School, which we started. I started in 2000, and so that had kind of progressed, and they're doing fantastic things with it. And because of that interest in robotics, I decided to go into medicine and urology, which is always at the forefront of medical technology. And us urologists have done robotic surgery since the early 2000s, and it was just very attractive to me. And I wanted to take my skills and apply them to patient care, which I have been able to fortunately do here.
Before we jump into the topic, which we're going to talk men's health today, where do you practice? Where can people come see you?
So I'm at Mon Health Medical Center here in Morgantown. I'm on the fourth floor of the hospital. Patients can call or go online to monhealth.com/urology and make an appointment or request more information.
I'm going to paint with a very broad brush here, Dr. Shakuri-Rad. Men don't like to talk about. We don't like to talk about our health. Why is that?
I think it's some folks consider it maybe a point of weakness, for us to talk about things that are wrong with us or things that we're unsure about. So us men like to kind of act, quote unquote, manly, and because of that, we may have aches and pains that we just brush off and don't pay attention to, and we may not be aware of some screening that's recommended for us. As we get older, obviously we don't know what we don't know, so we have to really listen to our family physicians, to our other providers that are trying to get us as healthy as we can be so that we can live a long, healthy life.
How do you know when something, or how do you know the difference between, an ache and a pain, or maybe you went out and you played one-on-one with your buddy and you're just not 22 anymore? How do you know the difference between that and something that needs to be treated and something that needs to be looked at?
That's exactly the point about not knowing what you don't know. And I think when we have aches and pains that are consistent, that are constant, that don't go away necessarily after a couple of days, or something new has happened that wasn't there before, those are good things to bring up. Majority of family physicians see their patients on an annual or biannual basis. And during those visits, it's important to bring those things up. A lot of times we go to our family doctor appointments and we just say, oh, everything is fine, but we forget, hey, last month I had these new aches and pains. Bring those things up. The family doctors are the quarterbacks of our health system. They really know what's going on with you, and once they see that there's a red flag, they'll approach you about it and send you either to another specialist or order testing to find out more.
So as a urologist, what are some of the common conditions you see and treat in patients?
So the urology includes the urinary tract, which is your kidneys, ureters, bladder, and in men specifically the reproductive organs. You could think of urologists as us dealing with systems mostly below the belt for men, but also kidneys, so all the way up to your upper abdomen. And, when I talk to my patients about urology and how they should approach their men's health, I talk to them about cars a lot, even though I'm not necessarily the most knowledgeable person about cars. But a lot of us guys understand cars and like cars, and we talk about the general upkeep, the maintenance, like we do with our cars. And there are some warning signs that we have to pay attention to, like check engine lights.
Yeah, now you're talking my language. I like the metaphor there because we do understand that when it comes to that analogy. So, as I mentioned, it's June is Men's Health Month. So, what are some of the top health concerns with men, especially here in West Virginia?
So I always say, start with a general upkeep, just like you do with your car. In order for your car to run, you have to keep your gas tank full and air in the tires. And so we have to also make sure that you're paying attention to the oil of the car, and that's the analogy is drinking water. Your body needs water. It consists mostly of water, and drinking 6 or more cups of water daily may prevent things like kidney stones. Kidney stones are very prevalent in West Virginia. We treat a lot of folks with kidney stones, and drinking more water can be a very easy way of trying to prevent some of those episodes. Getting exercise. If you have your car sit idle, it may fail over time. So this is true of our bodies as well. So trying to do about 30 minutes of moderate exercise 4 or 5 days a week can really make a big difference, not just for your urologic health, but your overall men's health. And then stress plays also a role. So you wouldn't let your car engine rev all day because that wouldn't be good. It could damage your car. And so you shouldn't do that with your body either. You don't want to have that constant stress all day, every day. And the data shows that even if you relax for about 10 minutes a day, that can lower your blood pressure, which may improve your overall health. And in men specifically, things like erectile function. Eating healthy is a big thing that we don't pay attention to as much, especially here in West Virginia. You wouldn't put dirty fuel into your car. Some guys are as careful as selecting a specific gas station to go to because they have better gas to put in the car. Same idea for the body. If you put things like caffeine, alcohol, a lot of spicy foods, those things can irritate your bladder and cause bladder problems. Red meat, high-fat diets, they can increase risk of things like kidney stones. We talked about kidney stones and prostate cancer as well. And so we really want to focus on the high-octane foods, if you will. These are things like fruits, vegetables, and fiber.
What kind of exercise do you recommend? Does it have to be 2 hours at the gym or running 5 miles a day? What kind of exercise would you recommend? Does it depend on the age?
It does depend on age, but also, we most guys, when we say exercise, they think, oh, my God, I got to put aside an hour a day, go and get a membership at the gym and pay my fees. That's not what we're talking about. Even things as simple as when you go to the grocery store, park in the parking space farthest away from the door and walk all the way to the front door and walk back. That alone gives you 5 minutes of exercise. When you're going to a building for if you're coming to the doctor's office, for example, instead of taking the elevator, take the stairs. And those little things add up throughout the day. And in today's technology age, a lot of people have watches or smart trackers, health trackers like Fitbits, and that records your steps. So that's how you get more steps in, if you just make those small adjustments. Now, some of us are able to go to gyms and do those things, and that's great. But for those guys that also have some joint issues, they can actually do water exercises and going to the aquatic center, for example, or the public pools. You can do those exercises in the pool, and that's really easy on your joints as well.
Talking to Dr. Shakuri-Rad this morning, urologist and robotic surgeon with Mon Health. We've got to squeeze in a break, but we'll continue the conversation in a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Shakuri-Rad is our guest this morning, urologist and robotic surgeon with Mon Health. And doctor, what tests and screenings do you recommend for men and at what ages?
So I think that's kind of our maintenance schedule. So we talked about the general upkeep, going back to that car analogy. And so for your maintenance schedule, There are three categories, really. We talk about young men. These are men between age 18 and 40. And they should really just consider basic care and do testicular self-exams. Testicular cancer is more prevalent in this age group. And also pay attention to their family history. If there's a family history of bladder, kidney, or prostate cancer, they should definitely talk to their physicians about that. Then we go to that kind of middle-age category, ages 40 to 50. And those patients really should watch their gauges, if you will. These are values like your blood pressure, blood sugar, cholesterol. All of these things can cause kidney disease and erectile dysfunction. Screening for prostate cancer at this age may become important for some men. There are men who have a family history of prostate cancer, and they should really get at least one blood test called PSA in their mid-40s. And the men that are a little bit older, ages 50 to 70 and beyond, they should remember to get their routine health exams with their physicians, family physicians, but also prostate cancer screening is very important. Prostate cancer occurs in 1 in 8 men, and that's the second most common cancer in men after lung cancer. Also, we need to look for changes in bathroom patterns like urgency, frequency, a decreased flow, or frequent nighttime urination. Whenever I go to ball games, I look and see how many men are getting up from their seats and going to the bathroom and how packed it gets. And those are the men that can't enjoy, a quarter of a ball game because they're going frequently. And that's really a red flag. You should really go get that checked out. BPH, which causes a lot of these symptoms, is very prevalent in men. As a matter of fact, by the time a man reaches age about 80, we estimate that 90% of men will have BPH and will need treatment for this disease. Blood in the urine is another red flag. That's not normal at all. Even if it happens one time, you should go get that checked out. Often we need to do a workup, make sure we rule out all the scary things and find out why there was blood in the urine.
There's one friend of mine I know very well who preaches PSAs, very routine blood tests, but those numbers can tell you a lot, can't they?
Absolutely. And a number doesn't diagnose you. We really look at you as a whole person, but that number is very important and a very important piece of the workup, because if it is elevated, it may raise a red flag, and that red flag needs to be pursued a little bit more. Just like if you get a check engine light, you're not going to sit on it. If you sit on it long enough, your car may run for some time, but at the end it may fail. And so you want to go get it checked out by a mechanic, in this case a urologist, because your number may be elevated. And prostate cancer, being the second most common cancer in men, is also the second most common cause of cancer death in men, unfortunately. And the main reason for that is because, again, men don't get screened and don't get treatment at an appropriate time. If a man with prostate cancer receives appropriate treatment, their 10-year survival is often close to 98 to 99%.
Dr. Shakuri-Rad is our guest this morning. You mentioned prostate cancer. It's going to happen in 1 out of every 8 men. What are some symptoms associated with prostate cancer?
So prostate cancer, we call it the silent cancer because often you don't really have specific signs and symptoms, but you may experience things like urinary symptoms. We talked about that slow stream, going to the bathroom more frequently, urgency, frequency, nighttime awakenings. Also, occasionally men may experience blood, either in their urine or in their semen, which is also a red flag. Aside from that, really the screening is important. We always recommend a blood test as well as a physical exam to ensure that we don't miss localized prostate cancer.
Dr. Shakuri-Rad is our guest this morning. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Dr. Shakuri-Rad is our guest this morning, urologist, robotic surgeon with Mon Health. We're talking about men's health, as June is Men's Health Month. And Dr. Shakuri-Rad, what have been some recent advancements in men's health and in robotics and all the above here?
So, about 5 years ago when I came here, I wanted to really bring all the latest and greatest and best-in-class treatments to West Virginia. And I think we have been able to accomplish that. We were the first to, and remain the only center of excellence in robotic surgery for things like prostate cancer, kidney cancer. I was very fortunate to perform the first ever single port robotic surgery in West Virginia here recently, and we remain the only hospital that offers that here in the state. And this is a procedure where we make a very small incision, about 2.5 centimeters, and are able to treat things like prostate cancer, kidney cancer, bladder cancer, and various other diseases. We were the first and only hospital to offer advanced prostate cancer treatments called Provenge for metastatic prostate cancer. For BPH that we talked about, we were the first and remain the only center of excellence in the Urolift procedure, aquablation procedure. We perform laser prostate surgeries for BPH. And we also offer treatments for overactive bladder, and are the only center in our region that offers both axonics and interstim sacral neuromodulation to our patients. And we definitely do all of the other urologic treatments, such as kidney stones, lithotripsies, ureteroscopy. So for patients who are really looking for best-in-class care from physicians who are at the cutting edge of urologic care, there's really no reason to go out of state anymore. And in this day and age, it's really a misconception that best care can only be achieved at places like Johns Hopkins and Cleveland Clinic and academic centers. The hospital doesn't really provide people with care. It is the physicians and the medical staff. And at Mon Health, we really have the best of the best and nothing less. And I always make, recently I had a family member of ours who lives in North Carolina asked me where they should go and get care for their urologic problem they were having. And I didn't send them to University of North Carolina or Duke. I actually sent them to a community urologist who offered the same things that I offer. And because we know that that's where you get that family atmosphere, the best-in-class care, and people treat you like family.
We've only got a couple of minutes left, but quickly, I wanted to ask you about kidney stones. I've heard about them. I don't want them. How can you prevent kidney stones? Can you prevent them? Number one, Dr. Shakuri-Rad. And number two, how do you treat them?
So kidney stones are really multifactorial, meaning that there's a combination of dehydration, dietary factors. The most common kidney stone in the country is calcium oxalate, and oxalate is something we take in through our diet. Things that are actually sometimes considered healthy, like spinach, have high oxalate content. A lot of nuts have a lot of oxalate in them, and so various foods. And then the third thing is genetics. Sometimes we just can't run away from our genetics. And so, but if you do have a healthy diet, a kidney stone friendly diet, as well as drink lots of water, we talk about 8-9 cups a day, then you can prevent kidney stones. And if you do happen to get them, then we can treat them here at Mon with multiple different treatment options, from minimally invasive lithotripsy to ureteroscopy, where we go in with small cameras and retrieve the stones, to laser surgeries. So all of those treatments are outpatient typically, and as long as you're following with a urologist, you should be able to receive care very promptly.
Is it as bad as I've heard the stories of?
Oh yeah, it's unfortunately most of my female patients always compare it to childbirth, and most of them tell me, you know what, if I could pick between getting another kidney stone and having another kid, I would pick having another kid.
Yep, that sounds like some of the stories that I've heard. Hey, where can people contact you or find out information, learn more?
So I think these days people like to go online. So certainly if you go to monhealth.com/urology or my educational page, radroboticsurgery.com, you can get a lot of information about various different diseases that we deal with. Also, just placing a phone call to our office and asking about information or making an appointment I do take patients sometimes just by them calling. And your family physician, if you're unsure, your family physician can really direct you. If you say, hey, you know what, I have this problem, but I'm not sure if I need a urologist, your family doctor can help you and send a referral to us.
Dr. Shakuri-Rad, urologist and robotic surgeon at Mon Health. Doctor, always enjoy the conversation. Good catching up with you again.
Always a pleasure. Thank you, Dave.
Thank you.